can happen before a big event, graduation or holidays, etc., when changing pads or cups or tampons is a big hassle. But what do you do when you're worried that Mother Nature or Aunty Flo may visit you the night before or on the morning of your wedding? We know this is already a potentially stressful day, so in this video I'm going to share some methods that you can use to ensure that the only mothers or aunties that tell about your wedding are the ones that you invite. Make sure you stay till the end of the video because I'm going to be answering some questions about your fertility and when you've delayed your period, and using ibuprofen to postpone your periods. If you want to be sure you will not have your periods during your wedding or honeymoon, the safest option requires planning months ahead. Yes, you can use a method that starts working within days, and I will talk about that in the video, but it may not necessarily be the safest for you. If having a period-free wedding is so important to you, then plan it ahead of time. I will be talking about hormonal methods in this video, so please remember they do have side effects. If you want to learn much more about different birth control methods, check out my playlist here on smart birth control. So the first method, for a woman using the combined contraceptive method like the pill, the patch or the ring, you can skip the break in the month of your event and continue straight on to the subsequent pill or patch or ring. This back-to-back method, as we call it, will allow you to have no periods until you come to the next break. Since you're already on this method, there are no new health risks to you, and the risk of developing, for example, a blood clot because you're starting a new contraceptive method is absent. Mind you, this does not work with the mini pill or the progesterone only pill. The next method, number 2, requires even longer planning. You will need to have been using the Depo Shot injection, that is the Depo Progesterone injection. This method allows you to have a progesterone injection every 2 or 3 months for birth control purposes. Within 12 months of using this method, most women will stop having their periods. So if you are a bride-to-be already on this method and happy with it, you don't need to worry about your period spoiling the day. If you're thinking about a July wedding next year and already on this method, that solves the problem. But this method might not suit everyone. Some women struggle with Depo Shot side effects, as you see in my video here. But if it suits you, it solves the problem. The next method is using the progesterone containing tablet taken from a few days before the scheduled period for the month of your event and continuing until when you want your period to start. Commonly in the UK, the drug used is called norepinephrine. To use this method, you should have regular menstrual cycles because that gives you an idea for when your next period will arrive. It's a popular method. In the case of our July bride, she should know when her period in June happens, which will give her an idea of when the period in July is due. So she can start taking those tablets 3 days before the due date in July and carry on taking them until she's ready for her period to start. So if you want to use this method, it's important that you're speaking to your doctor early enough to get a prescription. I hope you're finding this video helpful. Please let me know by liking it, subscribing to the channel, and tell me in the comment section as well. Back to norepinephrine, does it have any side effects, and why do I say that you should speak to your doctor first? In terms of side effects, it has a few. It can cause breast tenderness, headache, dizziness, dry mouth, nausea, or acne outbreaks in some women. In addition, it might affect your mood and sex drive. It can also increase the risk of developing a blood clot. Please make sure you read the information leaflet before taking the medicine. You should not use this drug if you're pregnant, have any form of liver disease, or have had a blood clot in the past. There are a few other conditions which do not go well with this drug, so please make sure you are speaking to your doctor about your medical background and whether it is suitable for you or not. If you're good to use this medicine, you can expect your menstrual period to start 2 to 3 days after you stop taking the drug. So these are some of the hormonal methods you can use to postpone your period before a big event. If you think ahead of time, you can choose a method that suits you, so please make sure you're checking that it's safe for you to use. Thank you for sticking to this point of the video. Now, 2 questions related to this. How does postponing your period affect your fertility? None of these methods I've talked about has any permanent effect on your fertility. Using norepinephrine, your periods and fertility return as soon as you stop taking the drug. And the same applies when you use your combined pill or combined method back to back. However, the Depo Shot can delay fertility fertility, so please note this for when you're planning to start having children. If you are using or planning to use the Depo Shot, please remember that fertility can be delayed for up to 12 months after stopping the injection, so please make sure you factor this in when making your choice for birth control method. Next, is it okay to use Ibuprofen or Nurofen to postpone your periods? This is a popular thing in some places. I heard someone share how to stop their period within minutes simply by taking a mixture of ibuprofen with some jelly or jello. So essentially, it's the ibuprofen effect they're looking for, not the jello. But we don't recommend this, and for a couple of reasons. A high dose of ibuprofen might lighten heavy bleeding, but it might not be able to stop it completely, which defeats the purpose if you're trying to postpone menstruation. However, there are some drugs similar to ibuprofen which are non-hormonal and which we use to treat heavy menstrual bleeding. This is not the same as postponing the period. And secondly, ibuprofen, even though it's commonly sold, does have serious side effects. It's not meant for everyone. For example, people with asthma, or people who suffer with gastric ulcers or acid reflux disease, or people with kidney disease. It can irritate the stomach or the bowel lining, leading to bleeding from the gut. It can also contribute to kidney failure if taken without care. So please avoid using ibuprofen in high doses for this purpose. Follow the advice of your GP or the drug information leaflet. We've talked a whole lot about the Depo Shot in this video. If you'd like to learn more, please check out my playlist on smart birth control, and if you want to learn about fibroids, check out this playlist. Don't forget to like and subscribe, and I'll see you again soon.